Today is the deadline to sign up for health plans under the Affordable Care Act. More than 11 million people have signed up so far for coverage in 2017. Their plans will take effect at the beginning of March. But with President Trump vowing to repeal the law, many people may be unsure about enrolling. Shannon Pettypiece is a White House correspondent for Bloomberg News. She joins us now from Washington. Shannon, good morning. Good to see you.
Good morning. Good morning.
So does it make sense to enroll knowing that President Trump has made it clear he's going to do everything he can to get rid of Obamacare?
I know there's so much confusion out there right now about the law, but yes, it definitely does make sense to enroll right now. If you want health care, go out, buy it on these exchanges today. I've talked to the health insurers about this, and they say that this is how it works. Even if the law is repealed, they have essentially entered a contract with you. When you sign up for a plan, you agree to pay them this amount of money. They agree to provide you this sort of level of coverage in these services. If you stop paying, that contract's in void. But as long as you're paying for your policy through 2017, they will offer you that coverage as it's laid out for you and agreed to when you sign up for coverage today.
But if it's repealed this year, how long will it last?
So, of course, yes, if you like your plan, you might not be able to keep it because we don't know what's going to happen. Through 2017, you're okay, but going into 2018, that's the question. And what Republicans are talking about on Congress right now, they haven't really reached an agreement on whether they are going to replace the law and repeal it at the same time, what they're going to replace it with. So come 2018, then that's all up into question about what type of plan you'll be able to get that year.
Republicans say that they're waiting for Tom Price to come and to be confirmed so that he can come over and sort of help shape this legislation. Is that the missing ingredient here from a replacement standpoint?
So Republicans had a big gathering last week in Philadelphia where they were hoping to get more clarity on what their plan was going to look like. Once they get Tom Price in there, they'll have an advocate in HHS, but they've still got to get something past Congress and signed by the president. I do not feel there's any more clarity on Capitol Hill this week than there was last week. There's still a lot of divided factions within the Republican Party about what this plan should include, and there's a sense they're probably going to need some Democratic help for this plan. So there's still a question about how do they get Democrats on board while meeting all the things that Republicans want to see in this new replacement plan that they hope to get through.
Is there some sense that there's some good things here that they ought to protect?
Well, I mean, one is the expanded coverage. I mean, we have a lot more people with health insurance than we did, several years ago. So, that's one thing that everyone would like to protect is the level of coverage. And the Republicans definitely don't want to be the ones who are getting blamed for millions of people losing their health insurance in 2018 if they come up with a plan that can't continue to coverage that level of people.
And it's interesting to note that the approval rate for the Obamacare plan is higher than it's ever been. More people have signed up for it now this year than they did last year. What impact will that have on Congress that wants to start from scratch?
Yeah, well, it just means that there's more people they're going to have to find a solution for that they're going to have to cover. And it also shows that there's more people benefiting from this law. And we've already been seeing sort of a groundswell, I don't think it's to the level of the summer before Obamacare was passed, but a groundswell of support for this law. Hundreds of people showing up at some town hall meetings, really trying to make sure that this plan is protected.
Shannon Pettypiece, thank you. Good to see you.